Hello, good morning to you. It's Tuesday, the 4th of August, 2015. This is Newsbreak. It's live from your most authoritative news network from our studios at Laboni in Accra, also on DSTV, channel 277. And Newsbreak, it's one of our many news platforms where you can bet to get the news first. Let me run by you our top stories making headlines right now. Ghana Medical Association to be dragged before the National Labour Commission as government declares it cannot continue negotiations under Durex. Meanwhile, the National Health Insurance card holders are uncertain about treatment at private health facilities following government indebtedness to them. Also coming up, group calling itself National Youth Leaders Forum describes demand by medical doctors as outrageous and unsustainable. Formal launch of the long-term National Development Plan for Ghana takes place today. Traffic build-up around the Weja Toll Booth area getting out of control. Motorists are demanding alternative routes to free the highway. And later, kingmakers of Equiapim advised to use due process to elect new paramount chief following the formal announcement of the passing of the Equiapim Hene Osadeyo Adodankwa III. Details momentarily. Hi there, you're welcome back to Newsbreak. And I am Ignatius Ano. Let's take a closer look at the news now in detail. Resume work because your strike is illegal and we cannot negotiate with your dagger pointed at us. That's a government plain language to striking medical doctors. Employment and Labour Relations Minister Haruna Iddrisu issued a statement yesterday threatening to drag the Ghana Medical Association to the National Labour Commission. Here are extracts of that statement.
Government wishes to reinstate its commitment to the creation of a conducive working environment for all public sector workers. In this regard, government has lately been in discussion with the Ghana Medical Association on conditions of service for medical officers. It should be noted that the demands contained in the proposed conditions of service have never existed in the past. Government wishes to know that already the Public Service Joint Negotiating Committee, PSJNC, is involved in a universal discussion of Category 2 and 3 allowances. Any negotiations of such allowances must therefore be in line with the work of the PSJNC. Further, it is important for government to conduct a financial analysis of the impact of any such conditions of service on government expenditure in order not to adversely affect the annual budget approved by Parliament. Also, as a result of the need to maintain equity and fairness in public sector remuneration, especially in order not to jeopardize the recently implemented single spine pay policy, it has become necessary for government to seek the advice of the Fair Wages and Salaries Commission on the demands put forward by the doctors. Government is therefore of the view that while these processes are ongoing, it is unfair and against the rules of labour practice for the GMA to declare a partial strike by withdrawing all outpatient services. This amounts to coercion and an attempt to compel government to negotiate under duress. The current withdrawal of services is illegal and government calls on the GMA to call off the partial strike with immediate effect.
Uninterestingly, medical doctors in the Upper East region have joined their colleagues across the country in embarking on the strike action that is being described as illegal by government. Let's speak to our Upper East regional correspondent, Edward Adeti, who joins me on the telephone lines with the very details. Edward, nice to have you on Newsbreak. So what's pushing the doctors in the Upper East region today to join their colleagues to strike?
Well, it's not good. This basically is as a result of the pressure being mounted on the doctors who have the reason to join their position on strike in Ghana as it is right now. That's what some sources at the regional health directorate and at some hospitals, public hospitals here in the region address the that they have just finally have to take this decision because of the mounting pressure from the CMA, from Accra and elsewhere on the sector. And this is why they are taking this decision. And I think it is to add that Sapetokam as a top to about 1.2 million people in the region here who have been looking to the doctors in the region here for medical attention. After this right now, Navrongo War Hospital, where we have about 3 doctors, have withdrawn to make OPD attendance, OPD attention, as well as OPD services, as well as emergency services. That is what Navrongo War Hospital has done. And in Bolga here, the Bolga Regional Hospital, for now, it is the OPD attention or services they have withdrawn. At this right now, they are only attending to emergency services. And, the other position the doctors in the region have taken, that's again, they are in the position of for these doctors who, for some time, have been on strike. Achieving the 1.2 million people in the region, they are assurance that they were not going to join their position on this strike action. But at this now, it has not come as just a job only. It has also come, the residents, those who are the OPD at that right now, particularly at the regional people,
right.
Stranded.
Right. Edward, I know the Upper East region is very vulnerable. This question is occasioned by the fact that back here in Accra and even in the Ashanti region, you can rely on other services, i.e. the private hospitals. Are there alternatives for people in that region like that?
Well, the problem is we do not have, just like you said, as many private hospitals as we do have or see in Accra and Ashanti and the other well-developed regions. And that's the problem here. Now, the stranded patients, the people that do not have anywhere to spend right now. I can count up about maybe 10, the region does not have up to 10 private hospitals as I speak right now. And this is a place where we have about 1.2 million people at present. And this is exactly where the latest action taken by the doctors in the region we have in the region here will be having a very good role on the residents. Navrongo has only 2 doctors. Bolga here has 12, comprising 5 specialists, 7 general practitioners, and then in Boku you have just 6 doctors. All of this together is not up to 20 doctors, not enough to 16 doctors or just about 17 doctors in the region, to about 1.2 million people. The doctor people has been and evaded over for a very long time now. And this is exactly where I know that the residents in the region have to a very painful skill of the ongoing and reason why the exact action by the CMA. Nothing.
Right. Many thanks to you. We'll call you when it becomes necessary. That's our man who represents us in the Upper East region, Edward Adeti, with the very latest. So doctors in the Upper East region have joined their colleagues in Accra and other parts of the country in this strike action that have been described as illegal, and government is asking them to go back to work or they will be dragged to the National Labour Commission. Let's do more stories in relation to this particular issue that the country is facing. And the police and 37 military hospitals are bracing themselves to cope with the influx of OPD and referral cases. Doctors and nurses on vacation have been recalled. And the police hospital intends to roll out a mobile service as part of measures to mitigate the impact. Meanwhile, the National Health Insurance Authority is advising NHIS cardholders who may be turned away from public health facilities to visit any private and faith-based hospitals and clinics accredited by the authority to access health care. But how can patients be treated when the government owes these private and faith-based hospitals and clinics across the country? Let's get in touch with the National Health Insurance Authority, and Selom Adonu speaks for them. We will try as much as possible to get him quickly to explain to us exactly what they intend to do, especially when we are being told they owe some of these accredited faith-based hospitals and clinics across the country, especially when they are advising these patients who are subscribers of the National Health Insurance Authority to get them. Shortly, we will be speaking to them, but don't forget that the strike action by the Ghana Medical Association has entered day 6 today. Yesterday, the Minister for Employment and Labour Relations, Haruna Idrisu, asked the doctors to return to work or else they will be dragged to the National Labour Commission. Let's do more stories. We'll shortly get back to the NHIA still on the strikes, and government and hospital pharmacists have also stopped work. The action even compounds the challenges facing managers of these health facilities. They are demanding proper placement on the single spine salary structure. Ajiman Bedu is vice chairman of the association and explains they've totally lost confidence in government.
The 3rd of August till the 10th, that is the first phase of our strike. And this will include the withdrawal of services to OPD patients. Night and weekend duties, we are not going to attend to our patients. Now, from the 10th to 17th, if nothing positive comes out from the Thursday meeting we intend to have with the Chief of Staff again, we will escalate or scale up our strike options to include emergencies, and all other services we provide to program, which has something to do with program drugs, which includes the HIV, withdrawal of services to ART services, and also to TB patients or any other program drug we have been supervising and dispensing to our patients.
All right, so Ajiman Bedu is vice chairman for the Government Hospital and Pharmacists Association of Ghana, GOSPA. Let's go back to the National Health Insurance Authority that has directed, or rather advised, NHIS cardholders to resort to the services of faith-based hospitals and clinics if they are being turned away by public health providers. And Salom Adonu is communications manager for the NHIA. Mr. Adonu, good morning. Thank you for joining me on Newsbreak. So, how sure are you? Have you officially notified these service providers that you're asking your subscribers to resort to?
All right, thank you very much. Unfortunately, what we find to tell is actually direct our mind for service to this area. It is just a normal, everyday work. The only difficulty is that, or the difficulty is that, the response to this, we have had it happen with some of the providers, for example, the Society of Private Medical Care Health and Fitness, that is starting with the rest of it, but everything where you are to the rest of it. So, we are still in the process of engagement, but the doctor strike is not a business at any time, and the fact was the decision of consistency to the employer.
Hello, Mr. Adonu. Mr. Adonu, can you hear me?
Yes.
Is it possible you reposition yourself? I hardly can have contact with you, but go ahead, but just reposition yourself.
Yes. Hello?
Hello, Salom.
Can you hear me?
Yes, I can. It's better. Go ahead.
Yeah, so what I'm saying is, we are only coming to basically get the effect of the time on public, especially our subscribers. That is really what we are doing right now.
Okay, so let me explain to you. In the Ashanti region, one of such facilities has categorically stated that it will not be able to attend to your NHIS cardholders because you owe them. Are there any guarantees for such facilities?
Well, exactly. I mean, we owe everybody. NHIA or NHIS will always owe, because at the very time of the we have to owe before we make this state. By law, we have to owe by a certain number of for pay, between a certain period. So, NHI is just a constant provided for by law. But sometimes there's time to pay later. And when that happens, it's about it. And keep them why it's late, but it's to resolve it. This is not the best of NHI. And this will not be the last time I will. It's part of our job. It's a business. It always has. So, so we are engaging with the service providers to engage with them. But of course, there is a private practice that we are not doing. We are playing the supply of private service.
right, many thanks to you. Selom Adonu is Communications Manager for the National Health Insurance Authority. This is Newsbreak. More news when I return. Stick around. Hello again. You're welcome back to Newsbreak. It's live on Metro Television. And I am Ignatius Arnold. Let's bring you some more stories. The formal launch of the long-term development plan takes place today. President John Mahama is expected to perform that under the watch of the two former presidents, Jerry John Rawlings, John Ejekum Kufuor, MPs, civil society groups, development partners, and various stakeholders in the economy. The document put together by the National Development Planning Commission involved local and international consultants as well as representatives of key political parties. The National Development Planning Commission has engaged various groups on the document and hopes its lessons have been learned and that governments will adhere to the 40-year plan to accelerate Ghana's development. Let's speak to Frank Nyonato, who joins us live for the very details to the story. Frank, nice to have you on the program. So what more can you share with us at this point?
Yes, I think that the president, yes, arrived at the program, right? Dignity, form, development, all of right. But the president expected to speak around 4 years that the way to get of development. Let's put it on record that blueprint document putting together because building over 100 years development for planning rights and colonialism. But this is even one on that side of contributions to all political parties in the country. One document, what do they mean? It is very constitutional for which it derives inspiration to national development. But one party that the NDC has received a clause to put in development plan, which is known as the lock-in law. The lock-in law makes it seeking to put across some form of restriction that the government comes into power and fails to implement any part of the national development plan. That government must be liable to some treatment for punishment. So we had a lot there how to play it out as well as that I said together.
All right, thank you. That's Frank Nyonato, one of our reporters, live at the former launch of the 40-year development plan that would be performed by President John Dramani Mahama. He'll be doing that under the watch of the two former presidents, i.e. Jerry John Rawlings and John Ejekum Kufuor. In other stories, traders who solely depend on polythene bags to package products foresee a major crisis without an alternative plan. So, in the wake of the partial ban, what do you think is informing or must inform this policy direction? My colleague Nana Kunedu of Ibobe reports.
It's difficult to tell when paper bags faded out from the system. They were common in the 60s and 70s. Then concerns were raised about possible chemical contamination from newspapers, cement paper bags, used exercise books and so on. Today, every little item sold on the market is wrapped. Take a typical woman who shops for the weekend. From stinking fish to all kinds of vegetables, just name them, is put in what has become known as takeaway bags. And these polythene bags come in sizes. So guess what happens if this ban becomes effective? The Awuza Koko or Wache seller, the separation of items bought at supermarkets, your favorite meat, and what about the water ordinary people drink? The rest is yours to guess.
First, no, yeah, the habani paper and a chichade. Instead, baby, no, Musay, Internet Musandan and rubber, my buying to say, Samuan Casamufi say, Robert no say, San Yedia, Mota de Mufi say, Bay, Mayano, Mufambra out.
The government, if you want to eliminate this thing, then you should bring another way. If there's a plastic product which cannot litter the compound or the country, then fine, we'll be okay with it.
Convenience, hygienic reasons, but whatever argument is adduced, final disposal is the major concern here. The increasing cost in managing waste, protecting water bodies and the environment, as well as disaster prevention, is now a headache. Manufacturers of light plastic bags are expected to dispose substandard products. 90 days from 1st August, no plastic bag will be available on the market unless it's biodegradable. All these light plastic materials are with less than 20 microns. That is 1/1,000,000th meter in terms of density technically. Partial ban takes effect 1st November 2015. Now traders are in a fix, uncertain about the future.
I sell beans, bangu with rice. So some of the customers I use rubbers and wrapping it for them. So if the government bans it, what am I going to use in putting their food for them? Then that means we must go back to the leaves. Somebody is there, nobody don't want the leaves.
I sell banku and akple. It's really going to affect us because we wrap our akple with the polythene, and if government stops that, I don't know how we are going to go about that. If it's rice, then we can use the leaves. But now that is something that involves soup, I don't think there will be something else.
The Environment Ministry is recruiting 2,000 staff to enforce the ban, but it seems it has more homework to do to ensure this initiative doesn't result in another crisis. Nana Kunedu of Ibobe, reporting for Metro News.
Your morning sports is next when News Night returns, or News Break returns.
Welcome back from the break and welcome to your morning sports update. I am Akosia Adeyamo. Our attention is on officiating, and Chairman of Referees Committee MNS Doe has called on tougher sanctions against referees and clubs that engage in bribery. He believes that would deter clubs from trying to influence matches by sorting out referees.
We appoint the right caliber of referees to officiate matches. Our referees too, depending upon report that we receive from the centers, have also done well. If I'm to access them very well, I'll give the referees 85%, both the Division 1 and the Premier League. So, yes, the Referee Association is a human institution. It is never perfect. Referees can, at certain times, falter. But it does not mean that some of these things, in most cases, are intentional. Some could be intentional when it comes to the notice of the committee, and for that matter, the review committee. Such referees are sanctioned when the matter is gone into. Is it possible? Can a referee bribe himself? It is a club that do that. If indeed they claim there is bribery in it, if referees take bribe, it is the clubs who bribe the referees. So I believe that when something of that nature is discovered, we need to take drastic action. Like, for instance, the Unity Bofakwa case, where it was claimed that our referees, the referee, his two assistants, and the fourth official were bribed, that the referee negotiated with the team Unity that he was taking 900, the assistant 1, assistant 2, and the fourth official also took 700 apiece, 700 each, bringing the total to 3,000 cedis. I think the FA Disciplinary Committee should go into this matter, and then the guilty party, if indeed Unity is found to have indeed bribed the referees, Unity must be demoted to a next division. You see, it's not merely asking them to, not imposing some pecuniary punishment on them, but then they must forfeit the division in which they are now. They must go down. When we do that, it will be a very big deterrent measure which will scare clubs who will want to bribe referees.
And that's it for your morning sports update. I am Akosia Adeyamo. Over to you, Ignatius.
All right, many thanks to you, Akosia. It's an interesting take that he had there on officiating and refereeing. I mean, I've always had my challenges when I sit behind my TV and I go like, this person is just messing people up. Yeah,
it's true. It's a good thing that clubs should pay more so that they can't bribe the referees. They should be sanctioned for it and should be tougher.
So pay the referees well as well, so they don't have to take bribes.
Well, it doesn't matter. Someone could be really paid well, but still will take bribes.
So. That's a point. Thank you, Akosia, with the very latest in sports. Let's do some other stories on News Break. Okay, rather, I guess I have to go after my time is up. And I am Ignatius. I know I thank you for watching. More news for you on top of the hour. Good morning.